Hi, I'm Robin Forster with FeelSoAlive and FeelSoAlive Informed. And today we have a special program, and I want to introduce my friend Megan Daly. Megan, you want to say hi?
Oh,
Excellent, thanks. And today we're going to be talking about trigeminal neuralgia, which is basically a very strange disease that folks have. And Megan has this vast, okay, let me give you the bio on Megan because that will really help to explain what's going on. So Megan has, oh, and I'm going to be looking down at my notes, just so you know. Megan, with 8 years of PT practice, has great tips for folks on migraines and dizziness, which is her specialty. And then we're going to get into the vagus nerve. She is a PT, a DPT, a CHC. She's experienced in physical therapist and a health coach. And some of those initials mean that she's a doctor of physical therapy. And she also has a certificate in vestibular rehabilitation. Did I say that right?
yes.
Oh, good. Okay, great.
Thanks.
And she likes helping patients regain control of their lives because when you're dizzy or you have migraines, it just impacts your whole life so much. She currently has her own mobile physical therapy coaching practice and is co owner of Dizzy Coaches, a vestibular mentoring program for all levels of vestibular healthcare providers. She has experienced many of these conditions personally and brings that empathy to all of her client interactions. So, Megan, did I kind of cover the high spots on your bio?
Yes, definitely. That was great, Robin.
Awesome. Okay. So let's get into trigeminal neuralgia because I'm sure that the folks watching this on the replay are going to either be wondering what it is because they've never heard of it, or it's going to be people who are affected by it and are looking to see if there's anything new, any suggestions. So, why don't we start with you explaining what it is?
Yes. So, trigeminal neuralgia, we can break that down, break the words down. So, neuralgia means nerve pain, and the trigeminal nerve is a nerve that comes around kind of from the ear and then it comes across your face in three main areas. So you've got the ophthalmic branch, which is around the eye, and then you've got the maxillary branch, which is to the maxilla, so the upper mouth, and then you've got the mandibular portion, which is around the jaw, the lower part of your mouth. And you've got that all three of those on both sides. You've got two trigeminal nerves that come down, one on the right and one on the left. And so what happens is you can get nerve pain, and this can happen sometimes from compression. If there's a blood vessel that's touching the nerve or something else that's restricting that space, then you'll feel that pain. Most commonly, you'll feel it down here in the maxillary branch or in the mandibular branch. It's less likely to happen up above. And this is important because the trigeminal nerve is sensation for your face. So if you touch your forehead or your cheeks or down here, that's all your trigeminal nerve doing the work. So when you have nerve pain, you're just getting that extra signal there that can be very, like you said, that you were calling it the dragon. So it's very uncomfortable.
And when we were talking before we started filming, I do have trigeminal neuralgia, and Megan knows this. We've talked about it before, and when I found out what she knew, and it's kind of weird to say that in third person because we're right here hanging out together. But when I found out what you knew, it was like, oh, great. Okay, let's share this because it's the kind of disease, I guess is the right name for it, that it's very hard to deal with, and there's, quote, no cure. But there are a lot of things that we can do. So before we get into that, can you talk about how people figure out that that's what they have? Because I know it took me years to figure it out.
Yeah, it's definitely one that can be harder to diagnose. It can often be missed, especially if the pain is intermittent, because sometimes there really isn't a pattern to it. The trigeminal nerve also helps with chewing. So sometimes people will feel it then. And so it can be hard to differentiate where exactly the pain is coming from. sometimes they'll look at the TMJ, that joint, the jaw joint instead. So it can get missed that way, and it can just be unpredictable. So just having symptoms, pain kind of off and on in the face can be hard to diagnose. Some people can also experience like muscle spasms or tics. And so unfortunately, sometimes people get written off as saying this is all in your head. It's just anxiety, or it's a psychological condition, and it gets overlooked, or it just kind of gets dismissed as, well, if it only happens every once in a while, then it's not really a big deal. But as we've talked about, it can be very, very much a big deal and interfere with your life.
It can, and that's a piece that I think is so important, is the pain level. Because sometimes, on a scale of like 0 to 1, where 0 is no pain, or sorry, 0 to 10, and 10 is extreme pain, sometimes for folks with TN, the pain is at like a Mach 20.
Mm-hmm.
It's totally off the scale. And
Right.
trying to describe that to somebody, because I remember one time I was getting ready to walk up the stairs, no big deal, and the pain was so intense that I had to stop and focus on breathing, because I was holding my breath, because it hurt, it wasn't fun. And so I think that's a piece that people don't really realize. Even though you're looking at somebody, nothing's happening to the face, doesn't look any different, but their eyes are going wonky because they're in so much pain.
Right. Which,
I shouldn't laugh, it's serious, but
yeah.
yeah.
Yeah. Because that can come out of nowhere, and they can do imaging and things like that, and it doesn't show up necessarily on that. So it can be that, hard to diagnose when you just have this sudden pain out of nowhere, and then it goes away again, and it's hard to pinpoint where that's happening.
Yeah, exactly. Yeah, thank you for saying that, because a lot of times I think those of us who have it's like, well, are we really crazy? Well, we're not, because that really hurt. And so, and I didn't do anything. I was just standing here talking, and all of a sudden, the dragon appeared. And yeah. So let's see. Why don't you talk a little bit more? I'm looking down at my notes again. Why don't you talk a little bit more about the vagus nerve? Because that is such a key, and no one really talks about it.
Mm-hmm. Yeah, so the trigeminal nerve and the vagus nerve are both what we call cranial nerves. So these are the nerves that are around your head and your face. And the trigeminal nerve is the largest nerve of those. There's 12 of them. And then the vagus nerve is the longest nerve. So the vagus nerve goes all the way down into all of your organs. And it really helps control your overall nervous system and helps you kind of end up in that rest and digest area. So that we can split the nervous system up into two portions. So there's your fight or flight, which is kind of that active and alert response. And then there's the relaxed state, which is the rest and digest. And so if you've got irritation, if you've got pain, that's going to push you into that fight or flight response. And then it's going to be really important to activate that vagus nerve to help calm down your system and get you back into that rest and digest phase.
Oh, I'm glad that you said that, because I would have thought that we wanted to deactivate the vagus nerve. So I had it totally backwards. So we want to activate it so we can get into rest and digest.
Yes.
Ah, okay, that helps a lot.
Yes, because that can help also control inflammation. So there's some neat little vagus exercises that you can do to activate it.
Oh, good. Okay, so hold that thought, because we need to definitely go into those things.
Yeah.
And especially the inflammation piece, and watching what we eat and our exercise. But we'll hold those thoughts too, because you had some options for treatment that I think you wanted to go through first.
Mhm. Yeah, so I know it's hard sometimes to get a diagnosis, and this seems like such an overwhelming thing. That can be a big stressor right there. But then once you get the diagnosis, that can also be stressful too. So it depends on what you're looking at. Sometimes people feel hopeless when they find out. But there's a number of things that you can do, and it's definitely trial and error. It takes some effort, but there's a lot of different options out there to help with trigeminal neuralgia. So typically the first thing that your physician might do is try some medications, and that's outside of my scope, but people have success with those medications. And then when I'm looking at it from a physical therapy standpoint, we're going to look at all the movement in your face. So looking at the jaw, the joints, looking at the muscles. Is there anything there? Is it tight? Are you grinding or clenching at night? Because that can sometimes trigger the pain and the compression on the nerve. So there's a couple techniques that we can do in physical therapy. And one of those is doing electrical stimulation. So like a TENS unit or little microcurrents, and those can help with that nerve pain. There's also neck exercises that we can do because the neck is so close to the face, right? So making sure that all of that is working smoothly and that your muscles and joints are in their best position and for comfort. And then also there's facial mobilization. So there's, just like we would work on an arm or a leg or a back and mobilize it, you can also do that on the face. And so some physical therapists are specifically trained in it. You can also do, there's a number of different providers that will do that sort of mobilization. So there's osteopaths that do it. You can also do some craniosacral therapy, and they will do the mobilizations around your face and around your mouth.
Great. Yeah, and I think that you gave me the name of a person for
Mhm.
craniosacral, and I'm working on getting in touch with her because,
Nice.
yeah, I would love to interview her because it's kind of like, okay, that's the next piece, in this puzzle. So that would be awesome. Let's see, we were going to talk a little bit about breathing exercises and nutritional changes. And there is a book that, and I apologize for not getting it down ahead of time,
Mhm.
that was really, really good talking about this. And I'm not seeing it on my bookshelf, but it's usually right there where I
Right
can
there.
grab it easily. So I will have to put that in the program notes at the end because it's written by Dr. Oz's father-in-law, I think.
Interesting.
Because, yeah, his sister-in-law and I may have the relationship a little bit messed up, but anyway, very close family. She had trigeminal neuralgia.
Okay.
And even though Dr. Foz's father-in-law was a cardiac surgeon, he delved into this and came up with a lot of nutritional suggestions.
Nice.
Yeah, and came at it from that direction. So that was very cool, and I do want to share that.
Mhm.
Um, Looking at our list of questions and things that we wanted to talk about, and there's so many. Um, yeah, because
I
we
know we just scratched the surface on things you can try too. I mean, that was just the initial part of it. And then you can dive into all the lifestyle techniques and acupuncture, anything that affects the nervous system and helps calm it down. So if you're okay with needles, acupuncture can be a great treatment too.
Yeah, I remember doing acupuncture when my insurance covered it.
Mhm.
And it was very helpful. It did calm down the nerves. And at one point, seeing a different acupuncturist, because everyone's style is different, uh, we were able to shift it from one nerve to the other, which turned out to be okay.
Mhm.
Yeah, it was interesting. So, are there some exercises that you want to share with us as we keep on going along? Some things that people can try at home?
Mhm. Yeah, so one of the first things that you can do is just relaxation techniques. And this can be any form of meditation or prayer. It can be just sitting calmly and just giving yourself a 30-second break in the middle of a chaotic day. Because that stress, it doesn't necessarily have to be related to your trigeminal neuralgia. Like if you're chewing or something that can trigger it. But if you just had a busy day and you're running around and you've got all these things to do, that stress can sometimes increase your pain as well, because of this would be a whole other topic about how pain works in your brain and the nervous system. So just taking a moment to sit and just stop and let your system calm down a little bit, come out of that fight or flight response, can help you calm down some of that trigeminal neuralgia pain.
Excellent. And I was just thinking about a fun little vacation meditation that we were talking about earlier today with some friends, where you close your eyes or lower your gaze, wherever you are, however it works for you. Put yourself in your happy place outside, whether it's at the coast, the lake, in the woods, hiking, whatever it is. And then my favorite breathing is where you inhale for 4, for 4 counts, and then you kind of pause and hold it, and then you exhale for 6. Yeah, I know, And to do that a couple of times, because that mini vacation, you can do that in what, 2 minutes?
Mm-hmm.
And then go on with your day. And I found with TN, why not try almost anything?
Mm-hmm. Right.
Yeah. Because, and especially something that's healthy and good for you,
Yes.
it's like, there's no reason not to try.
Yes, and also easy and free too.
Yeah, easy and free. Yeah, is awesome. And that was one of the things that we were talking about too, is the whole thing about tapping. And did you want to say, I know that wasn't on our list of things, but I've been kind of enamored with tapping lately. And did you want to share something on that and the how or the why or whatever?
Yeah, tapping is really interesting because that can help release some of that stress and that pain. Because when you have that pain, you can tend to store it in the body, and tapping will help you release that. It also, again, it's one of those techniques that helps calm down your nervous system.
Oh.
So, what's your favorite tapping point?
I'm so new that I don't have one.
Mm-hmm.
Uh, I appreciate having a tapping someone else to talk me through it
Mm-hmm.
versus me trying to read the directions and look at the
Mm-hmm.
pictures, and I find
Right.
that a little bit challenging. Uh, so yeah, I'm just learning about it. So I'm appreciating you sharing how it works, because I know that it does, and some people don't think so, and that's fine. They don't have to try it.
Right. Right.
There's lots of options. Was there something else? Let's see, you've got on our list, avoiding cold temperatures on face and beverages. Did you want to talk about some of those things?
Mm-hmm. Yeah, because the trigeminal nerve is a sensory nerve, so it's sensing touch. It can also be sometimes irritated by temperature. So if you have an extreme temperature, especially cold temperatures, so if you have anything cold on the face, or if you're drinking a really cold beverage with lots of ice, then that can irritate it sometimes too. So if
Interesting.
you're okay with it, you can try to warm up your beverages a little bit, try room temperature water if you can tolerate it, or put less ice cubes in. And, if you're out in the cold, put something over your face, because you can get those face masks and the little warmers that go over your face too. So all of that can help so that the nerve's not quite as irritated. Because I know sometimes people just get the pain from being like in a cold wind.
Yeah.
So having, just one of those little buffs or a scarf or something over your face can help keep it warmer.
Yeah, I've had some friends who walked into a room and it had been so cold, and the change between cold and warm, that she had to turn around and leave. She was just, in so much pain. And it's like, okay, we need to figure out some ways of dealing with this, because that's not fun to have your lifestyle impacted so much. In fact, one of the things we were going to talk about was support and family support. And do you want to go into that a little bit?
Mhm. Yeah, support is definitely one of the lifestyle factors we look at when we look at treatments. So having good family support and friend support can also make a huge difference. And again, it calms down the nervous system, because it can be so hard to not get a diagnosis or be told it's all in your head. You want to make sure that your family and your friends understand what's going on too, because it can be really hurtful if they are dismissing it in the same fashion and just saying it's all in your head. So finding the people that are supportive and understand what's going on and believe you and recognize that your pain is valid it's really helpful to have them as cheerleaders as you work through the different treatments, as you try different things, because it does take some effort to work through it.
Yeah, I think that's such an important piece, and also communicating with the people who are in your support system and letting them know how they can support you.
Mhm.
Because I know there's been times where if that I would not want to go out and eat in public because of the pain, and when I was eating with family, I would usually put my hand in front of my mouth because it was less painful to chew with my mouth open.
Mhm.
Which, I mean, who wants seafood? It's just really not okay to share. And so it was nice to not have to worry about what they thought of me. Just like, you guys, it's either this or I don't eat.
Yeah,
One or the other. Yeah. And we just have a few minutes left. This time went so fast.
I did.
Yeah, are there some things that you want to share, some techniques that we haven't covered, or some must-says before we end?
Another good technique that's also free and easy is just trying to desensitize the area that you get the pain in. So, just testing to see if you can tolerate that light touch on your face and just do that along the line where the nerve is. So, whether it's on the right or the left, you can just do this just light movement and just do that regularly so you can desensitize that. So you're basically telling the nerve, it's okay. We don't have to get painful, that everything's okay when there's touch or when there's temperature. And then you can increase this. So one of the things that we would do in physical therapy is increase that. So we would start really light and then we would change it and progress it. When someone else gently touches your face, it's completely different than when you touch your own face. And so there's different levels and ways to just keep training your nervous system to not react.
Interesting. See, now
Mhm.
that's something that I haven't looked at all,
Mhm.
in looking for alternatives. Because for me, medication is just not an option. I've just
Right.
heard so many things about it that were not appealing.
Mhm.
And I know there's some surgeries out there, and those don't appeal to me either. And so that's why I've gone the alternative route of, what can I do? And that's why it was so fun to find out that, yes, you're also interested in this topic. I was like, oh, good, let's share some alternatives.
Right.
Yeah, because sometimes they're hard to find.
They are.
You've got to do some digging.
They are, yeah. And sometimes it takes, having cheerleaders too, because some of it is lifestyle changes, drinking more water or eating less inflammatory foods. And so making those changes are things you wouldn't necessarily think of right away.
That's a very good point. And there's the whole world of nutrition when you talk about anti inflammatory foods and not eating foods that are inflammatory. People don't necessarily know.
Right.
And so that's a whole nother piece to get educated on. But it's so worth it. I know with my food supplements, there's some that I will not go without because I'm convinced that they help.
Mhm.
And that's the book that I can't find that
Yes.
I know is just right here on my bookshelf. And it talks about some different vitamins and how they were effective. So I will
Mhm.
put that in the notes so people can find it.
That's great.
Yeah, and let's see, Megan, I'll make sure that I put your information in the notes. So if people want to follow up and ask you more questions, because I know you have a ton more information, and we could talk about this for
Yes.
days.
I know. I said we could have a whole series on this. We could go, for weeks. Yeah.
Exactly, which is very tempting.
Yes.
And for me, I should let people know right now I'm in remission, which I am really appreciating and trying to stay focused because every once in a while, as Megan was saying, I'm calling it the dragon today, will rear its head just out of the blue. And it's like, oh, okay, I need to not do whatever is causing that and to start doing the other things that I know that seem to be helpful. So, I think that we should probably end before I ask you another question and we go down another rabbit hole.
Yeah. That sounds good. But if anyone has any questions, then please contact me.
Excellent. Megan, thank you so much for your time. This
Oh
is
yeah. Thank you,
awesome.
Robin.
Oh, and I was going to tell folks that we had you on the program on March 11th. So if they want to go back and just see 10 minutes of you talking about some more basic things and a little bit more about dizziness, that they're welcome to do that. And I will put that link also, so make it easier. Okay, well, thank you.
Thank you, Robin.